On this Monday night, a tougher crackdown at Canada's borders. What the federal government is considering to further restrict travel and keep more contagious coronavirus variants out.
We're looking at that very actively right now.
Plus, the protection the Moderna vaccine provides now and how the company is bracing for more mutations. Buy America. U.S. President Biden's plan to pump up his country's economy. Grounded, Israel's new ban on flights and the exceptions. And one very long year of COVID-19 in Canada.
The plan should have been we lock down.
The lessons learned and how science has evolved.
Global National with Donna Friesen.
Good evening and thanks for joining us. It is January 25th, 2021, exactly 1 year since a single story began to dominate the headlines. Coronavirus confirmed in Canada. One official case, another presumptive case. Their connection.
This new case isn't surprising.
Plus, new questions over how the virus spreads. Now it's 1 year later, after more than 19,000 Canadians have died of COVID-19, and there are still questions about how it spreads and mutates. The most urgent concern right now, those highly contagious new variants, which spread much faster. It's not known how prevalent those variants are in Canada. Finding them requires genomic sequencing, and not every positive case goes through that. A handful of cases of the variant first detected in South Africa have been confirmed in Canada. So have dozens of cases of the one first discovered in the UK. In Ontario, 34 people are known to be infected with the UK variant now, and it's feared it is present in a second Ontario long-term care facility. In Alberta, it was confirmed today there are now 20 cases of the UK variant. 19 of them are known to have a connection to travel. One does not. That is an indication it is spreading in the community, which the health minister said today is very concerning. Here's what could happen. New modeling from Simon Fraser University suggests if a more contagious variant takes hold in the community, the situation could lead to a sharp spike in cases, that red line. SFU researchers say tougher measures are needed, including stricter travel rules to prevent a looming disaster. The federal government is considering imposing new measures to restrict who comes into Canada and to discourage non-essential travel. Mike Couture is following that tonight, plus the latest on the delay in vaccines. Mike?
Well, Donna, government sources tell Global News the Liberals are looking at ways to tighten up the Canadian border to outside travelers. Now, the Emergencies Act is still on the table, and we're hearing new measures to limit incoming travel could be coming very soon.
I also encourage the Prime Minister, close down any travel coming into Canada outside of residents of Canada.
Ontario Premier Doug Ford couldn't be more clear. He's worried that without a hard border closure, too many cases of COVID-19 and its variants are coming into Canada.
So if I'm doing my math correctly, 2.5% of 30,750 people slipping in through the border that have COVID.
There is already a requirement for travelers to have a negative COVID-19 result before getting on a flight for Canada. But the Deputy Prime Minister is hinting more is coming.
Our government absolutely is looking seriously and carefully at measures to further guarantee the toughness of our border measures.
The NDP says it's willing to work with the Liberals on a forced quarantine like Australia. There, people must stay in a hotel for 14 days upon arrival, a move that could be necessary as the virus spreads and the flow of vaccines has dried up for this week.
Next week, our order has been cut by 86%.
The opposition hammered the government on the lack of Pfizer-BioNTech vaccine deliveries. It's caused by retooling at the plant in Belgium. But the opposition wants to know why other supplies are off limits.
There are vaccines being made not far from us in Kalamazoo, Michigan. Did the Prime Minister ask for the ability to have that plant used?
The government says doses made at the American plant are earmarked for the U.S. in the first quarter of this year. And they maintain Canada will have the full order of 4 million doses by the end of March. Donna?
Michael Couture in Ottawa, thanks. A big question is how effective are the vaccines against the variants? Moderna said today its vaccine appears to work against the variant from the UK once both doses have been given. It also protects against the South African variant, but a booster shot may be required. Crystal Gamansing on what we know so far about the vaccines and the variants.
When it comes to fighting COVID-19, your system needs neutralizing antibodies. Vaccines deliver the code to build them. The code delivered in the Moderna COVID-19 vaccine is less effective against the South African strain. A study by the drug company suggests the vaccine's effectiveness is reduced roughly 6-fold. However, when it comes to the UK variant, the vaccine produces the same level of neutralizing antibodies.
We see very high level of antibody. With B117 strain from the UK.
Health officials in multiple countries say the data is helpful, but does not change the current recommendations.
For the purposes of the vaccine rollout, whether people have had the old or the new variant, it doesn't matter. What you need to do is get vaccinated when the call comes.
There seems to be a considerable more threat to vaccine efficacy, even though the cushion of efficacy is sound enough that the vaccines that we're using now will be good against both the mutant in South Africa as well as in the UK.
If any country bets everything on the vaccine, we're going to lose. That's the bottom line. The vaccine is one tool.
Moderna is working on a booster shot based off of the South African variant. There are also other vaccines in trials and new therapies being studied.
I think we're going to be going into a period where we'll want to be seeing even more collaboration across producers to try and then together look at how do we both assess the changing environment we're in.
An environment made all the more challenging with the continued and rapid spread of the virus. Crystal Gamansing, Global News, London.
The CEO of Great Canadian Gaming Corporation has resigned after accusations he and his wife traveled from Vancouver to Yukon to get the COVID-19 vaccine. 55-year-old Rod Baker and 32-year-old Ekaterina Baker were charged and ticketed in Whitehorse on Thursday. The couple was required by territorial law to isolate for 14 days when they arrived. It's alleged they instead chartered a private plane to a remote community and received the Moderna vaccine. They reportedly claimed to be employees of a local motel. They were both fined over $1,000 each. Baker resigned from his casino job on Sunday. The BC government has released a long-awaited report into how that province handled the COVID-19 outbreaks in long-term care homes. It was commissioned last summer. Critics say it took too long to be made public and say the recommendations have yet to be implemented. Robin Gill reports.
The first death from COVID-19 in British Columbia was at this long-term care home in North Vancouver. Since then, there have been more than 262 outbreaks at care facilities that have led to 72% of pandemic deaths in the province.
If you look for a theme through this, you'll see there's a lack of coordination and consistent communication. And that has always been an issue.
That response from the head of the BC Care Providers Association in response to a report commissioned by the BC government on how it guided long-term care homes. Among the findings, there was no coordination in planning, sourcing, purchasing, and distribution of PPE. There were inconsistent messages on how to isolate positive patients. There was inconsistent infection control across care homes. And while it was the right thing for the public health officer to order staff to work in one facility to control the spread to other facilities, it left staff shortages elsewhere.
We are learning as we go. And we know, of course, that this virus is transmitted through people. And it is very challenging for us to know when people are incubating the disease and when they can transmit it to others.
Now, BC is in the midst of a second wave. Have lessons been learned and changes made? The health minister insists yes, but COVID is still here.
What's happened in November and December and now January in this second wave of COVID-19 is significantly more community transmission, and that reflects in long-term care.
Clearly, this report has not been implemented because many of these same issues are still there.
If there's one lesson from this pandemic, it's that the vicious virus knows its target, the vulnerable. Robin Gill, Global News, Vancouver.
Lynn Beyak, the senator who defended Canada's residential school system, has announced her retirement. Beyak was facing an imminent vote on a motion which sought to make her the first ever senator to be ejected from the Red Chamber, citing individual racism. She has argued residential schools were well-intentioned, and she was kicked out of the Conservative caucus for publishing racist letters against Indigenous people on her website. And Brampton MP Ramesh Sangha has been removed from the federal Liberal caucus. In a statement, the chief government whip says Sangha was removed after making baseless and dangerous accusations against a number of his caucus colleagues. Global News has asked for details of those accusations. None have been provided. In Washington, the American President Joe Biden signed a Buy American executive order today. It directs government agencies to strengthen requirements about purchasing products and services from the U.S. businesses, and it boosts the level of U.S.-made content a project would need to qualify as made in America. That could make it harder for Canadian companies. The order also applies more stringent standards to hard-won exceptions Canada secured to the rules imposed by former President Barack Obama. Also in Washington, the impeachment case against former President Trump is inching closer to a trial in the Senate. Late today, a procession of House members carried the article of impeachment to the Senate. Trump was impeached for a second time January 13th, charging him with incitement to insurrection. Trump is already out of office, of course, so why proceed with this next step in the Senate? Jackson Prosco explains.
The moment that nearly shattered democracy will be the focus of the historic post-presidential impeachment trial of Donald Trump.
He tried to kill American democracy. There isn't any doubt about that.
Trump was impeached by the House for incitement of insurrection.
You'll never take back our country with weakness.
Now a Senate trial, which would normally seek to remove a sitting president, will instead aim to disqualify Trump from holding public office in the future.
If he were somehow or other to secure a second win as president of the United States, American democracy would be dead in any form that we would recognize it.
It will take all 50 Democrats and at least 17 Republicans in the Senate to convict Trump, a tall order, even with Senate Minority Leader Mitch McConnell leaving the door open.
The mob was fed lies. They were provoked by the president and other powerful people.
Trump still has plenty of allies.
We already have a flaming fire in this country, and it's like taking a bunch of gasoline and pouring it on top of the fire.
The trial won't start for 2 weeks, an eternity in politics, leaving time for other damaging evidence to emerge, like reports Trump considered firing the acting attorney general in a bid to press the Department of Justice to intervene and overturn the election. There are concerns the trial will serve as another flashpoint for violent pro-Trump extremists. The fences and 7,000 members of the National Guard are being kept in Washington until it's over. And while all that's going on, there's mounting legal trouble for Trump's allies. Dominion Voting Systems, which was thrust into the center of Trump's election conspiracies, has filed suit against Rudy Giuliani, Trump's lawyer, seeking $1.3 billion in damages for what it calls a viral disinformation campaign. Donna?
Jackson Prosco in Washington, thanks. The other executive order President Biden signed today repeals the ban on transgender people serving openly in the U.S. military.
All right. Thank you.
It reverses a ban former President Trump ordered during his first year in office. Biden tweeted today, "America is safer when everyone qualified to serve can do so openly and with pride." Anger erupts over pandemic restrictions. Coming up, the outrage in parts of Israel and the Netherlands. Israel has banned most flights in and out of the country to try to keep out more cases of the highly contagious COVID-19 variants. The ban is in effect for at least 1 week. Exceptions will be made for things like cargo, funerals, and humanitarian needs. Prime Minister Benjamin Netanyahu says a rising number of highly transmissible variants have been detected. Israel is in the midst of a third nationwide lockdown, and it has the world's most ambitious vaccination campaign. More than 25% of Israelis have received at least one dose. Palestinians in the West Bank and Gaza are not included in Israel's vaccine rollout. Ultraorthodox protesters angry about lockdown measures set a bus on fire last night in a suburb of Tel Aviv. The mob beat the driver, who says he survived by the skin of his teeth. Ultra-Orthodox communities in Israel have resisted shutting down their schools, yeshivas and synagogues, and some young extremists have violently taken matters into their own hands. In Amsterdam, more than 100 people have been arrested after weekend protests. They defied a ban on public gatherings and a new curfew. Police fired a water cannon and used tear gas. Angry demonstrations erupted on Saturday after the Dutch government imposed its first nighttime curfew since the end of the Second World War. Residents must be in their homes between 9 p.m. and 4:30 a.m. or face fines. The country's case numbers have been dropping over the past month, but the government fears COVID-19 variants could lead to a surge in new cases. Can those who beat the virus bend the pandemic's rules? Ahead, experts answer your COVID-19 questions.
You're watching Global National.
We've learned a great deal about COVID-19 in the last year, but new questions keep emerging. And so we still have our Jeff Semple on the case, trying to get answers for you from the experts.
The approach that we're taking allowed us to identify this patient immediately.
Exactly 1 year since Canada confirmed its first case of COVID-19. Some are wondering whether they might have been infected even earlier. Carol writes, "I think I had COVID-19 in January 2020, but was never tested."
It could have been influenza or another respiratory virus.
This infectious disease specialist believes she had the virus back in March, but was also never tested, though she says cases in February and January last year are less likely. After Canada's first case, doctors began testing some patients, but by the end of February had only identified a dozen infections, and the first confirmed community spread wasn't until March. But if you want to be sure, some private clinics now offer antibody tests.
The question that I'd like answered is there any planning underway with the public health effort to take into account the number of people who are now immune?
Some countries are considering so-called immunity passports for those who've recovered from COVID. Iceland, for example, now allows travelers with proof of prior infection to visit without quarantine. But Canada has no plans to follow suit.
Since we don't really know how long the natural immunity for COVID will last.
I was just wondering about wearing masks outside in the winter with COVID. I'd heard that COVID germs don't dissipate as quickly as they do in the summer.
She's right. Respiratory droplets fall faster in hot humidity than they do in the cold, dry winter.
It becomes a lighter and lighter droplet, and that can float around.
But the extent to which that raises the risk of infection is a matter of debate.
I think cold temperatures or warm temperatures mostly irrelevant. If you're outdoors and you're physically distanced from others, the likelihood of getting this infection is exceedingly rare.
But in a Canadian winter, masking up outdoors can't hurt and can help provide a layer of protection, not to mention a face warmer. Jeff Semple, Global News, Toronto.
COVID in Canada 1 year later. Next, what we've learned and what we have not. This is an anniversary we'd certainly rather not be marking. Since the first case of COVID-19 was confirmed in Canada 1 year ago, public health experts have repeatedly told us this is a marathon, not a sprint. But even marathons have a finish line. This virus has always been a step ahead of us. Eric Sorensen reflects on a year of COVID in Canada.
It was the first presumptive case of COVID-19 in Canada. A man returning from Wuhan, China, was hospitalized at Toronto's Sunnybrook Hospital.
The patient was detected and immediately put in isolation.
But could COVID health and government officials have been more tightly bunched to talk about it? How little we knew then of the coming threat.
The risk to Ontarians is still low, and things are managed and well controlled.
For weeks, it seemed well controlled. There were very few cases, but Canadians continued to travel carefree, still gathered in huge crowds, and were told there was seldom a need for masks in public.
What we worry about is actually the potential
negative aspects of wearing masks.
The mask is a wonderful example of this.
This epidemiologist says advice evolved over time on masks from limited to widespread use, but it's not evidence that science got it wrong.
It's completely acceptable to modify your opinion based on new information. That's how science works. Like, you modify your opinion based on fact and based on emerging data.
Canada has advised Canadians to curtail non-essential international travel.
By the time the country began to lock down last March, the response was remarkable. Governments at all levels and most Canadians readily accepted a dramatic shutdown in their lives. But over time, businesses reopened. Canadians began to gather again. The virus was able to make a comeback over and over.
We should have known that that was coming, because every time we have had a holiday, civic holiday, or anything which encouraged gatherings to occur, we always saw cases increase.
Governments, say experts, have not done enough to keep the virus in check, with better tools to screen in schools and with sufficient testing and contact tracing.
The plan should have been, we lock down, you drive the case numbers down to something reasonable, and you deploy extraordinary public health assets to keep the numbers simmering at a low level. Backwards contact tracing, you find the source of the outbreak. And on top of that, rapid testing.
Now we're facing a new threat, much like we did a year ago. New COVID variants being discovered so far in small numbers. But this year we won't have the excuse that we don't understand it and didn't see it coming. Eric Sorensen, Global News, Toronto.
And that is Global National for this Monday. I'm Donna Friesen. Tonight's Your Canada is this Labour of Love, a skating rink the Petrie family made in Inverary, Ontario. Just gorgeous. There are beautiful spots all over Canada. Please email us yours to viewers@globalnational.com. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.